Hello, it's good to see you again in Vnews Bulletin broadcast from Hanoi. I'm Ngọc Ly and now the headlines. Prime Minister Nguyễn Phúc on March 31st had issued a range of stringent social distancing measures, including restricting people from leaving their homes and banning gatherings of more than 2 people in public. The order will apply nationwide for 15 days, starting Wednesday, April 1st, in order to limit the spread of COVID-19 that has shown no signs of abating. The principle is that each family isolates itself from other families, one village from other villages, one commune from other communes, one province from other provinces. Only factories, businesses, and service establishments producing and providing essential goods and services are allowed to open and ask to ensure workers follow strict health guidelines. This includes ensuring they wear face masks, keep a safe distance from each other, and make sure areas are properly disinfected and sterilized. All people are ordered to stay at home and only go out in case of emergencies, buying food or medicine, or going to work at factories and essential services that are not closed down or halt operations. Prime Minister Nguyễn Phúc affirmed that the government is yet to think of imposing lockdown of major cities during a meeting in Hanoi with permanent government members. The meeting focused plans, scenarios, and response to emergency cases related to COVID-19 nationwide, as well as social security policies to support those affected by the pandemic. The government leader said the country is now only at the pre-emergency stage, and the enforcement of social distancing at present stops at persuading and urging the people to voluntarily and fully follow measures to protect themselves and their families, he said. About epidemic response scenarios, the Prime Minister requested more drastic actions to protect the lives and health of the people. Now we come to the latest news on the acute respiratory disease caused by SARS-CoV-2. Vietnam confirmed 4 more COVID-19 cases on March 31st. Among the patients, one is worker of Trường Sinh company that has linked to the Bạch Mai Hospital in Hanoi. The other 2 are driver and friend of patient number 124 in Ho Chi Minh City. The newly announced patients also include a 10-year-old boy who flew from Prague to Istanbul and from Istanbul to Vietnam on March 15th. Also on March 31st, 2 more COVID-19 patients have been discharged from the hospital, raising the total recovered patients to 57. A 71-year-old British man, who's the 49th COVID-19 patient recorded in Vietnam, has been treated successfully at the Hue Central Hospital in Thừa Thiên Huế province.
Well, the doctors and the medical staff at this hospital have been amazing, absolutely amazing.
At present, the Hue Central Hospital is treating 2 COVID-19 patients, both of them British. Currently, there are many foreign nationals living and working in Vietnam. In the context of the COVID-19 pandemic, British Ambassador Gareth Ward and Consul General Ian Gibbons sent messages to these citizens to help them keep themselves and those around them safe.
Hello to my fellow Brits in Vietnam. In the last few weeks, we've helped hundreds of British nationals who were visiting Vietnam and who got into difficulties because of the coronavirus. Many of them have returned safely to the UK.
For those of you long-term residents and others with work or family networks who have decided to stay in Vietnam for the foreseeable future, Gareth and I will share with you a few tips to keep you and those around you safe.
The Vietnamese authorities recently introduced several new regulations to contain the spread of coronavirus in the country, especially in the big cities like Hanoi and Ho Chi Minh City.
As non-essential businesses and shops are now temporarily closed, locals and expatriates alike also play a vital role in stopping this outbreak.
Social distancing is what we must all do, but what does that mean? In Hanoi, where I'm based, the number of people out on the streets has reduced significantly. You should stay at home as much as possible, and if you need to go outside, always wear a mask. Aim to keep a minimum distance of 2 meters from people outside your household.
It's quite similar here in Ho Chi Minh City. The city authorities are requesting people to avoid social gatherings, but if absolutely necessary, must not have more than 10 people in a group outside the workplace, school or hospital. Advice on masks is also strict, so please don't get caught out. Make sure you always have a mask with you as you leave home.
You should also be aware that anyone suspected to have come into contact with coronavirus could be quarantined. Vietnamese quarantine centres are safe but basic, and most do not meet Public Health England standards.
The Vietnamese government has confirmed that it will cover all quarantine costs, but foreign nationals will be personally responsible for paying for any coronavirus hospital treatment costs and hotel costs from periods of self-isolation.
These restrictions are carried out to ensure public health and safety in Vietnam, and we urge you to comply with local laws and customs to avoid getting fined or punished. We're very fortunate to live and work in Vietnam. We should not expect to be treated differently from local people. So please respect the law, respect Vietnamese cultural norms, and show that you're playing your part in helping to tackle this global pandemic.
Please stay subscribed to our travel advice, details are shown below, and follow our social media to not miss any important updates.
We understand that this is a very challenging time for everybody. So my advice is stay at home except for essential activities.
And please do reach out to us whenever you need support. Thank you very much.
Thank you for your attention.
A teleconference of the Intersectoral Working Group of the ASEAN Coordinating Council on response to community emergency medicine took place on March 31st. The group was set up upon a proposal by Vietnam, the ASEAN Chair 2020, with a view to promoting cooperation in the ASEAN community to cope with the complicated developments of the COVID-19. ASEAN countries agreed to increase cooperation with partners in preventing infections and providing treatment for COVID-19 cases. They also pledged to work together to ensure safety for medical workers who are on the front line in the battle while maintaining the supply of essential goods for the people and preventing fake news. ASEAN will also intensify coordination to implement policies and measures assisting businesses. Member states pledged to maintain the opening of market, facilitate goods and trade exchanges, and ensure social welfare for the people. The European Council on March 30th passed a decision to ratify the EU-Vietnam Free Trade Agreement, or EVFTA, paving the way for the deal to come into force.
Once ratified by the Vietnamese National Assembly, the deal will officially take effect expected at the beginning of this summer. The EVFTA is expected to create a major push for Vietnam's exports, helping diversify the country's exports and markets. Under the agreement, Vietnam will cut 65% of export tax on EU commodities right after the deal takes effect, while the rest will be erased in a 10-year period. Meanwhile, the EU will cut more than 70% of tariff on Vietnam's commodities right after the deal takes effect, while the rest will be abolished in the 7 subsequent years. The document, together with the EU-Vietnam Investment Protection Agreement, was signed in Hanoi on June 30th last year. They include intensive, extensive, and comprehensive commitments covering the fields of economy, trade, investment, and sustainable development issues.
Vietnam's gross domestic product expanded by 3.82% in the first quarter of this year, the lowest growth rate posted in the past 10 years, showing the tremendous impact the COVID-19 pandemic is having on the country's economy.
According to the General Statistics Office, overall all sectors expanded at a much lower pace compared to previous years due to stagnation in major economies and disruptions to global supply and demand. The agricultural sector in the first quarter suffered from the impacts of African swine fever, drought, and saline intrusion in the Mekong Delta region. The business community was hard hit by COVID-19. We have seen a soaring number of enterprises temporarily closed. Trade and service activities in the first 3 months were also less active as consumers reduced shopping, travel, and eating out. The number of international visitors to Vietnam in the first quarter decreased by 18.1% compared to the same period last year. Meanwhile, the import-export turnover of many Vietnamese products also saw declines as COVID-19 spread among Vietnam's major trade partners such as China, the Republic of Korea, Japan, the EU, and the United States.
The Chi Minh City Department of Transport has decided to begin checking exhaust emissions in motorcycles from next month on a test basis.
The campaign will start next month and last until December. It will also communicate the benefits of reducing emissions and hold conferences to gather ideas from experts, policymakers, and official agencies about how to test emissions. The impacts on emissions on the city's socio-economic development will be assessed. The Vietnam Association of Motorcycle Manufacturers will fund the program. The country lacks regulations stipulating the maximum life of motorcycles. In many other countries in the regions, tariffs on old motorcycles are very high, and Hanoi and Ho Chi Minh City especially should consider solutions to take old motorcycles off their roads to limit their environmental impact, experts said.
With Vietnam in the grip of the COVID-19 epidemic, it has changed and disrupted the daily life of people in an unimaginable way. As seen in Ho Chi Minh City, the locality and its people are adapting to the changes brought by the epidemic. Every morning, Tao Dan Park in Ho Chi Minh City's District 1 is usually crowded because it's a popular place for people to exercise and play sports. But that was in the days before the COVID-19 epidemic was raging. In reality, there are not many people here anymore. Exercise is good for your health. However, crowded places are now posing the risk of infection.
If the park is closed, I can exercise, so I just do it at home.
The pace of life has slowed down due to the disease. As recommended by the city and health authorities, people have restricted travel and most people are staying at home. Many people now choose to do regular activities such as hair care at home instead of going out for a hairdo.
Now I take care of myself at home and follow the city's policy.
Stores and supermarkets are quiet, but online shopping and delivery service apps are getting busier.
Since the outbreak, I have often stayed at home and ordered more through online services. When we order online, we also practice hygienic and apply hand sanitizer so our customers can safely receive their goods.
The COVID-19 epidemic has had an impact on the entire economy and social life. Many fields and businesses are suffering from epidemic, and some have temporarily suspended operations. But for some others, this new reality offers them a chance to reinvent their businesses.
Now in the face of the outbreak, many people avoid going out. So now we have to do door-to-door services for people.
Disadvantages and shortages are inevitable in daily life when most activities have been temporarily frozen. However, if everyone is determined to win the fight and more drastic the anti-COVID-19 fight is, the life will soon return to normal. And it's also wrapped up our news bulletin. Thank you for watching and goodbye for now.